As we're preparing our content for our students in the classroom setting and the online setting or in the STEM and skills lab setting, we want to make sure that we're mapping to our learning objectives. This is not only important to help students achieve their outcomes, the learning outcomes that we have described in our courses, but also to meet accrediting bodies' guidelines as it relates to our program outcomes. As we're thinking about different ways to evaluate our students, of course, we have to use exams. We know NCLEX is the highest level of summative evaluation that our students must pass. And so we want to make sure that we are setting them up for success, guiding them using tools for evaluation to validate that learning has actually happened. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educators to achieve excellence on the certification exam. That may be CNE for you, that may be CHESI. So we may have some colleagues that are watching our content that are interested in the CHESI exam, or you may just be watching to become a better nurse educator. Whatever the reason that you are here, we are delighted to have you. We ask that you go ahead and subscribe to this channel so you'll be alerted every single time a new snapshot is released. And also, we want you to like this snapshot. All right, so we're continuing our discussion in exploring exam analysis. We know that this can be a challenging area for at least 30% of nurse educator colleagues that have reported to us that this is a challenging area. This is why we're focusing so much on this content to make sure that you have closed your knowledge gaps as you prepare for the exam or prepare to be a better nurse educator for your students. You're going to see on my screen the snapshot of the exam analysis assessment. We have two different levels. This is going to be the basic level. So if you head over to our website, nursingeducatation.com, you will see at the very top an area for you to receive your assessment directly to your email. And what you're going to see after you complete the assessment is going to be the correct answers. We want you to take time to, first of all, celebrate if you did choose the correct options for any of the questions. And then if you didn't get the answer right, we want you to celebrate as well, because that means you're one step closer to discerning what is it that you know related to exam analysis and what is it that you still need to focus on. If you want to dig even deeper into exam analysis, email us, info@drsellarseducate.com, and we will be happy to share with you the advanced version of our exam analysis assessment. All right, so on this journey, we're talking about the 5 steps regarding the exam analysis process. The first step in developing a valid and reliable exam based on Billings and Halstead and evidence-based literature that we've read is to ensure that we have a blueprint, that we have mapped our questions on the exam to actual content, to actual learning objectives. So that's the question we're exploring in this snapshot. How can blueprinting go wrong? Why doesn't it work? That's exactly what we're going to be talking about in part 1 of our time together. All right, so you all know we like to start with the thought-provoking question. If you haven't already, go ahead and look in the description. You're going to see a really important resource to help you on your journey, and that is the study worksheet. We want you to print that out every single time you show up for our snapshot. This is going to help you stay focused. All right, so let me ask you all, when is the last time you took a trip? Okay, where you were actually driving? What guided you to ensure that you were not going to waste time and you arrived at the destination that you are planning to get to? All right, so I'm sure we are using navigation these days. Of course, 20, 30 years ago, we had to use paper maps. Aren't we so glad that we don't have to do that anymore? What happens when we get off track, when we're using our navigation system? That's right. If you're putting in the chat right now, if you're watching this live with us, great. If you're watching this as a recording, then hopefully you are putting that it says recalculating or redirecting or rerouting. That's exactly what these notes are going to help you do. Reroute once you get, if you get off track, hopefully you won't. But if you get off track, that's exactly what these notes allow you all to do, is to refer back to the content that we've discussed, to reflect, to really help you clarify any muddy points that you have. All right, so what you want to put on that study worksheet that you've now printed out is going to be today's date, whatever day you're watching the snapshot. And then we want you to write down the objective. What is it that you want to accomplish at the end of our time together today? Do you want to better understand blueprinting and why it doesn't work? Do you want to identify perhaps some exam analysis components? Maybe you want to better understand p-value. If that's your why, then just know you'll need to stay tuned for future snapshots. Or maybe you want to go back and look at some of our former snapshots. And then you can write down any other key tips that you hear about during our time together during this snapshot. All right, so let's take a look at this thought-provoking question to get us started with item analysis. All right, so what we're going to do in this snapshot, we're going to start with a question, a thought-provoking question related to exam analysis, and then we're going to go backwards. Okay, so then we're going to look at blueprinting, mapping, and why it doesn't work. Okay, so we have an example of an item analysis data screenshot here that you can see that should be included from test development software. So that's the good news. We do not have to create or develop our own analysis, right? We have that available to us when we use our software. All right, so we have some data here that we want to talk through. First of all, we know that the correct answer is C. We know that the p-value for the actual question is 0.65, and we know that the point by serial index is 0.35, and we know it's positive. Go ahead and write down right now what this information tells you. Okay, so 0.65 for p-value, 0.35 for point by serial index. We have p-values and PBIs that have been given to us. So for A, you can see p-value is 0.09, PBI is negative 0.08. B option, p-value is 0.12, C value is 0.65, and D value is 0.11. PBI, again, for A is negative 0.08, which is the incorrect option, right? That's a distractor. The PBI for B is negative 0.21, another distractor. The correct answer, which is C, PBI is 0.36. And for D, the distractor incorrect answer is negative 0.25. Okay, so that's the information we have. And what you want to go ahead and write down is which one is going to accurately reflect the correct answer to the question. All right, and the question really is related to where do I start? All right, this is where we want you to start. We want you to break down what this information is telling you. What does it tell you about the distractor A? Is it effective? Is it not effective? What does it tell you about B? Same thing. Is it an effective distractor? And remember, hint, hint, an effective distractor is going to be negative. We always want our distractors to be negative. The other element that the information is telling us here is the difficulty, right? We know that the p-value for our correct option is 0.65. And that's what you want to think about. 0.65 is at a high level of difficulty or a low level of difficulty. All right. And then after you've written down all of your assessment elements related to that thought-provoking question, we're going to walk through these 5-step processes over the next several weeks. So first, let's look at the test blueprint. The purpose is very simple. It's going to make sure that the exam is effective in achieving the outcomes, the objectives that we expected it to. We want to make sure that we have validated that learning has happened related to those content areas, those learning objectives. So step 1, we want to be clear about those learning outcomes that we are measuring with those exam questions. We want to use Bloom's taxonomy, page 188 through 190 in Billings and Halstead. That's the 6th edition, is going to help better break down for cognitive learning domain all of the levels of Bloom's taxonomy. Okay, and this is what you want to know. Next is you want to be able to level those specific learning outcomes for each of those questions to the Bloom's taxonomy levels. Okay, so if you want to turn there with me now, page 188, go ahead and put in the chat what is the lowest level. The lowest level for cognitive learning domain on page 188, figure 10.1. All right, so if you're typing in the chat and if you're multitasking and can't type in the chat, we understand. But the lowest level is going to be remembering. And then we want you to take a look at the next level up, which is understanding. Even higher, or the next scaffold level, is applying. The next level up is going to be analyzing. The next level is going to be evaluating. And that highest form for cognitive learning domain is creating. Okay, so that's what you want to identify for your blueprint. Why do blueprints not work whenever we don't follow all of these elements, all of these steps in the process? that is what causes them to fail. We look at our exam analysis data, much like what we started with, and we wonder, why doesn't this exam analysis reflect what I intended it to? Why is it that my high scoring students did not choose the correct option more often than my low scoring students? Well, the first place we have to consider is going back to our blueprint. So that's why they don't work. Okay, mapping to our blueprint does not work when we don't include all of the elements that we are describing here. The blueprint also, as a colleague mentioned during our master class last week, it also helps us better break down concepts to our students and explain the rationale. If we already have this blueprint adequately mapped to our content and to our learning outcomes, it's a really easy story to describe to our students as it relates to content in our textbooks. It's harder to tell that story, to share that rationale whenever we haven't fully mapped our blueprint to our content. All right, and this is going to serve as linking, as it says here, for the level of learning outcome to the level of the test question. And we actually have an example that we're going to go through together. And then step 2, this is when we're going to determine the actual instructional content that is evaluated, and we're going to weigh the assigned content to each of the areas, or the assigned question, which we'll take a look in a second at an actual example. So the percentage of questions, or the percentage of the weight associated with that learning outcome, with the content that I have allocated that is aligned with that question, is going to help me as the facilitator, as the educator, have a clear understanding as to how much content I have explained for that specific objective to be met for the course. Okay, so stay with me. Let me explain that again to make sure I'm connecting the dots for everybody. Step 2, we're looking at what weight are we allocating to that specific area, to that specific question. That should correlate with the actual content, the amount of time I have spent reviewing that content, the number of questions that are going to be aligned with that content, so that I can ensure that learning has actually happened. All right, so if I'm not connecting the dots for you, this is what I want you to do. Go ahead and write that down as a muddy point, because we're going to go deeper with an actual example, and hopefully it will make more sense. All right, so this is the example of the actual blueprint that we want to go over. Going back to what I mentioned earlier, which is step 2, we can see respiratory conditions, COPD, ARDS, and pneumonia. We have allocated 180 hours to lecture related to that content. The next step is we want to allocate what percentage of hours are we actually going to address content related to objective 1, related to objective 2, 3, and 4. And then what is the number of questions on exam 1 related to that specific objective? And then the last step is, what is the level for knowledge and comprehension, those lower levels, and then the mid to upper levels that we just talked about. Some colleagues, some nursing programs actually map to the exact level of the taxonomy. That is recommended as a best practice. So if you want to go ahead and write out, add 3 or 4 additional columns so you can see the 6 different levels of the cognitive learning domain, then you can absolutely do that. For this specific exam, we only included 5 levels of Bloom's taxonomy, but you can certainly add the 6th level, especially if this is a course that is, upper level for our nursing students. We want to make sure we're incorporating the highest levels on the cognitive learning domain taxonomy. All right, so that's an example of what we were just talking about as it relates to step 2, the instructional content to be evaluated and weighted, assigned to each area. This is what we're talking about right here, the number of lecture hours and the percentage of hours, and then we correlate it with the number of questions. All right, so this is our example. We're just given just a brief component of the actual blueprint, okay? So this is an example. So we have 45 hours that we're allocating to describe the definition of COPD, okay? And then that's 8% of the hours, the total hours, which is 180, 32% of the actual exam questions are aligned with respiratory conditions. Okay, so that equates to 16 questions. 6 are going to be at that level of knowledge and comprehension, and I'm allocating 10 at the levels of application, evaluation, and analysis. Okay, hopefully this is making more sense now that we have an actual example. And then we have 45 questions that we're allocating for objective 1, 2, 3, and 4. Okay, and 8% is what 45 questions is equal to. Okay, so we have to divide by 4 the 180 hours. And then same thing, I'm allocating 4 questions for each of those. And then I've decided based on the content and the level of my student that I'm going to allocate 1 question at the lower level and then 3 questions at the higher levels. Okay, and then for objective 4, I decided to do 2 and 2. All right, so this is an example of a blueprint and how you're going to map it out so that your blueprint is successful and it doesn't fail. Okay, it's able to provide in real time a context for you to use and really a framework, a guideline when you're thinking about those questions that you're going to develop and the rationale that you're going to explain to your students related to the concepts and the content that we are actually evaluating. Okay, and then that last step that you want to do that we didn't include in this example is you want to add what was the chapter that you use to pull those questions from as you develop your lesson plan, your teaching plan. What specific chapters, page numbers did you use to engage students in the learning process related to those concepts? All right, so this is going to conclude our time together looking at blueprinting. So let's go back to our thought-provoking question. So let's break it down because that was the intent of this exam analysis example, was for you to break down whether or not the distractors were effective and if this was, based on the data we have, a good test question. All right, so A, we have a negative PBI. So yes, that's a good thing. 0.08 is low, right? That's only 8% of the students who chose option A. But what we do know about PBI being negative is that low scoring students chose this option more often than high scoring students. So it's a thumbs up. Okay. What do we know about B? We know that PBI is also negative. So that's a good thing for the distractor. And 21% of students chose this answer. More students in the low scoring range, or the low scoring students, chose this option more often than the high scoring students. So again, good thing. And then our last distractor was also effective. 25% of students chose that answer. Okay, so that's a good thing. So the correct option of positive 0.36 is good. Positive for the correct option means more high scoring students chose this option more often than low scoring students. So that's a win. And 36% of students chose this option. The next element we want to look at is p-value. 0.65 tells us that 65% of the students chose the correct option. Okay, so that means that it was, moderately difficult, but it's in that acceptable range, anywhere between 0.30 and 0.70 or so, 0.80, some parameters say, but anywhere between that range, greater than 0.30, says that it was at that appropriate level of difficulty. Now, this is the other caveat you want to remember. When we get to the upper ends, the 0.8, the 0.9, that means that it was not difficult at all, right? And what you want to think about is your mapping, right? You want to look back at your mapping and say, okay, if this was a question that was not very difficult, if it was, 0.8, 0.85, then you want to look and see, okay, where was it on Bloom's taxonomy and what level is my nursing student? So if, as an example, I have a semester 4 nursing student, right? So this is their last semester, I'm going to have these higher level of difficulty questions, right? So if it's determined on my exam analysis report that there was a low level of difficulty, so let's just say it was 0.8 or 0.85, well, when I do my exam review and I do my exam analysis and I determine that, you know what? I'm seeing that more high scoring students chose the correct option more often. So that's a good thing. And when I go to the exam review, I'm talking to students. And what do they tell me? That they were very knowledgeable about the concepts. I'm engaging in discussions throughout the semester. And when it comes to my exam review, I'm going even deeper to really validate that indeed my students were knowledgeable about these concepts. So, yes, it can be true that even though we have a p value that may be low, when I look back at my mapping, if I see that my PBI for my correct option is positive and is strong positive, so it's greater than 0.30, then that is going to give me more confidence that I have developed a very valid and reliable exam because my high scoring students chose the correct option more often, and it was supposed to be a difficult question, and my students that scored higher on the exam chose the correct option more often than my low scoring students. Okay. And same perspective. If it comes out that my exam analysis shows that this exam, the question was too easy, so let's just say it's back to that 0.8, 0.85, then what I'm going to say is, you know what? I'm going to have that conversation with my students, and I'm going to determine if they truly have grasped these concepts, if they've done so well at studying COPD that they have just simply grasped the concepts. I'm going to celebrate that. But perhaps in my next exam, I'm going to give a more challenging question to my students and see where it lands. Maybe I'm going to go up to that evaluation level or that creating level when we look at that, the levels of the cognitive learning domain. All right, so hopefully this snapshot has been helpful. Our goal is that our blueprinting is successful, right? That our blueprinting does not fail. Again, it fails when we don't do a good job mapping, when we're not clear about the definitions of each of these concepts, and when we do not go back and look at our exam results and align it with our blueprint to see how effective were those questions written, how effective did we meet our learning objectives, and ultimately, how well have we prepared our students for success in making those safe patient care decisions at the bedside. We look forward to seeing you in our next snapshot, where we'll continue to explore exam analysis. Specifically, we'll be looking at writing exam questions. All right, so that's the next snapshot. We're going to be talking about how do we ensure that we are writing effective exam questions to validate that learning has happened for our exams. Reach out to us if you have questions, info@drsellarseducate.com. We look forward to seeing you in our next snapshot. Have a great one, everybody.